Hey guys, it's Dr. Mahajan. I'm going to do a quick teaser. I'm very excited. We have Dr. Nihal Shah, who's a very well-renowned local psychiatrist for our program tomorrow on Facebook and YouTube and Periscope. Again, this is Dr. Mahajan from Mahajan Medical Center. I'm a board-certified internist, and we do a weekly webcast at 4:30. Tomorrow, Thursday at 4:30, Dr. Shah will be coming in. He's going to be talking about what's the effect of COVID-19 on psychiatric health or mental health of the population and how to cope with it better. We're going to put a link for CDC, and they have a great, insightful website on the symptoms and how to cope with the stress caused by COVID-19, who are the high-risk people with the mental health challenges. For example, the frontline people, the people who already have mental health issues, and food industry workers, teachers, anyone who has alcohol or drug, or substance abuse issues, or have obsessive compulsive disorders. All those people will be at higher risk for mental health with the COVID-19. So it's important to address that, and Dr. Shah will help us, break it down and help us to understand how we can cope with this better. We're going to be also talking about how the COVID-19 is affecting different communities in different ways. For example, if you are different socioeconomic status or different education, if you have less access to the tools, to write information, and they're getting more anxious. So I think knowing where you're getting your information is critical. I'll give you some tips, and he will expand them more on coping with the stress. Number one is less media consumption. So not more than 20 minutes a day, and going outdoors and connecting with the Mother Nature does help you release your stress. Connecting with the loved ones, making a phone call or Facebook or Zoom, or writing them an old-fashioned letter will help you relieve your pressures. Also, helping someone else to care for helps you more. Help you more with the stress relief. So what I mean is, let's say if your neighbor is elderly, if you help them, give them a call, knock on their door, say, "Hey, how you doing, Joe or Jane?" And see if you need any help. So it's good for them, it's good for you, and maybe get a grocery for them or something in those lines. So faith-based organizations are fantastic to connect if you're a person of faith in terms of getting some stress relief. But I won't recommend going physically to the churches yet. With the Pinellas County, the cases going up. If you look at it right now, it's 15,000, 12,000, 10,000 cases a day in Florida. So this is not a good time to go to church or restaurant or any indoor places. So keep your guard up. Hopefully in a month or two, this will get less. And then, you can do a little bit more, but keep your mask on, keep your social distancing going, and also wash your hands for 20 seconds. So don't let that guard down. So I'm very excited. Tomorrow at 4:30, we're going to have Dr. Nihal Shah, a well-renowned psychiatrist in our local area, sitting down with me and helping us to understand how the mental health issues are getting worse in COVID-19 and what to do about it. Again, this is Dr. Mahajan, and we're going to end our program today with a quick alternate nostril breathing practice. Hopefully you guys are doing that. It has wonderful effect, alternate nostril breathing. We touched on it in our previous webcast too. So I'm going to do few with you today, and then we'll expand as well tomorrow. So the first thing you do in the alternate nostril breathing, the other name is Nadi Shodhana, and it helps you with anxiety. It helps you with calming your mind down and meditate and breathe deeply and improve your endurance. If you're a swimmer or person who needs like COPD, CHF can activate your lung areas which have atelectasis or they are not as in action. So again, let's try that. So what you do is you put your left hand on your left knee and focus on your breathing. Breathe in and out, and breathe out. And then block your right nostril with your right hand, and then breathe in. And then block your left nostril with your ring finger and your little finger gently. And then breathe out through your right nostril. And then breathe in from your right nostril. And then breathe out through your left nostril. Keep your eyes closed. I'm keeping my eyes open to keep an eye on you. So breathe in again through your left nostril. And then close your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. Breathe in again. Close your right nostril. Breathe out through your, close your left nostril and breathe out through your right nostril. So do it like 10 times, 3 times a day. The best results are when you're doing empty stomach in the morning, but you can do it anytime. It will help you calm down. Do tune in tomorrow. This is Dr. Mahajan at Mahajan Medical Center and doing a teaser for tomorrow at 4:30. We're going to have Dr. Nihil Shah, a renowned psychiatrist, and he's going to talk about mental health issues we are having with the social isolation and COVID-19. With that, we come to the end of the teaser. Keep doing the good thing by washing your hands and keeping the mask on all the time while you're out and about. Stay away from indoor places like restaurants and churches and gyms and hair salon. Guys, we are the hot spot right now, so be careful, especially if you're elderly. And if you're young, you can bring it to your mom or your grandmother or your dad. So, be careful because of that as well. We come to the end of today's session. Do join in tomorrow at 4:30, and be nice to yourself, be nice to your family and friends, and be nice to Mother Nature. Ciao.